Hey everyone, welcome back. Today we're going to be doing a deep dive into dry needling.
Yeah, dry needling.
It's pretty fascinating stuff, and we've got some really interesting research here from Physio Hub that we're going to be looking at.
Yeah, there's a lot of buzz around it these days.
Yeah, for sure.
More and more people are interested in it.
And it's really interesting, we're going to get into the science behind it, how it actually works,
Yeah,
and what it can potentially do for you.
absolutely. I mean, it's not just a fad.
Right.
There's actual research supporting it.
Yeah, so let's just start with the basics.
Yeah,
What exactly is dry needling?
sure.
Because I know some people might hear needles and immediately think of acupuncture.
Right. That's a very common misconception.
Right.
So dry needling basically uses these thin, solid, filiform needles to target specific tissues in the body.
Okay.
So we're talking muscles, nerves, fascia, and the main goal is to release tension, reduce pain, and improve movement.
So it's not like an injection or anything?
No, it's not injecting anything. It's
no.
just the needle itself that's doing the work.
Okay, so how is that different from acupuncture then?
Right, so both therapies use needles,
Right.
but they have very different philosophies and objectives.
Okay.
So dry needling is based on Western medicine principles.
Okay.
It's rooted in our understanding of anatomy, physiology, and how nerves and trigger points can cause pain and dysfunction.
So it's not about energy meridians or anything like that?
Well, that's more of a traditional Chinese medicine approach with acupuncture.
Okay, got it.
So with dry needling, we're really looking at those specific trigger points, those knots you feel in your muscles,
Okay.
and we're using the needles to release those.
Okay, so that's where I get a little confused. How does sticking a needle into a muscle actually make things better?
That's a great question.
Yeah.
And it's something that researchers are still exploring, but we do have some pretty cool evidence so far. So one of the things dry needling does is it increases microcirculation in the area.
Okay.
So you're basically improving blood flow to those tissues.
Got it.
It also helps to increase nerve conduction velocity, so your nerves are transmitting signals more efficiently.
Wow.
And it can stimulate collagen production, which is essential for tissue healing.
So it's kind of like rebooting the system in a way?
Yeah, you can think of it like that.
Okay.
It's basically giving those tissues a little nudge to get back on track.
I like it.
And the research also shows that it actually increases local oxygen saturation in the tissues as well.
Interesting.
So it's really promoting a healing environment.
Okay, and I've heard that dry needling can also improve range of motion,
Yeah, absolutely.
muscle strength, even provide pain relief.
Yeah, there's evidence for all of that.
Wow.
It's particularly effective for short-term pain reduction.
Okay.
So it can really make a difference for people who are dealing with acute or chronic pain.
Now, what about electrical stimulation with dry needling?
Right, so that's called electroacupuncture.
Okay.
And it's essentially a way to enhance the effects of dry needling.
Okay.
So we attach electrodes to the needles and send a gentle electrical current through them.
Good.
And that's been shown to increase the production of beta endorphins.
Those are your natural pain relievers,
Exactly. And it can also decrease cortisol levels.
which is the stress hormone, right?
Yes.
Okay, that's pretty cool.
Yeah, so it's kind of like a double whammy against pain.
Nice.
But I do want to emphasize that while dry needling can be incredibly effective,
Yeah.
it's important to remember that it's most effective when it's part of a comprehensive treatment plan.
Okay, so it's not like a magic bullet.
Right, it's not a cure-all.
Okay.
It works best when it's combined with other therapies,
Right.
like pain neuroscience education, graded exercise, and manual therapy.
It's like a team effort.
Exactly.
Okay, so we've talked about the science, how it works,
Yeah,
but I bet you're wondering, how does this apply to me?
yeah.
Yeah, all the science is great, but how does it actually help people in real life?
Well, good news.
Yeah?
It turns out dry needling can be helpful for a pretty wide range of people.
Okay, so before we get to that, can you walk me through what an actual dry needling session looks like?
Yeah, of course.
What can someone expect when they go in for treatment?
So first off, you'd be meeting with a qualified practitioner,
Okay.
someone who's trained in dry needling,
Got it.
and they would do a thorough assessment.
Okay.
So they'd look at your posture, your movement patterns,
Okay.
and of course where you're experiencing pain.
So they're not just sticking needles in randomly?
No, definitely not.
Right.
It's a very targeted approach.
Got it.
So once they've identified those trigger points,
Okay.
they will carefully insert the needles,
Okay.
and you might feel a little sensation.
Okay. What kind of sensation?
It can vary from person to person,
Okay.
but some people describe it as a tingling
Okay.
or an ache. Some people even feel like a little muscle twitch.
Oh, interesting.
Yeah, and those sensations can actually be a good sign.
Really?
Yeah, it often means that the needle is hitting that right spot.
Okay.
Those tight, contracted muscle fibers that we're trying to release.
Interesting. So a little discomfort is actually a good thing in this case.
It can be, yeah.
Okay.
And sometimes the needles are left in for a certain period of time,
Okay.
or the practitioner might manipulate them a little bit
Okay.
just to further stimulate the area.
Got it.
And if they're using electrical stimulation, that's when they would hook up the electrodes to those needles.
Right. That electroacupuncture we were talking about earlier.
Exactly.
Okay, so what about after the session?
Yeah, what can you expect?
Yeah.
Well, most people feel a little bit sore
Okay.
or tender in the treated areas for a day or two.
Okay, that makes sense.
It's kind of like that good soreness you get after a workout.
Yeah, I know what you mean.
It's a sign that those muscles are being worked and they're starting to heal.
Okay, so it's nothing too crazy, just a little bit of discomfort.
Right, exactly. And there are things you can do to help manage that.
Okay, like what?
Well, you can apply heat or ice, do some gentle stretches, or even engage in some light activity as recommended by your practitioner.
Oh,
So it's not like you're completely out of commission after the treatment.
got it. That's good to know. But I'm guessing it's not a one and done kind of thing?
No, not usually.
Okay, so how many sessions would someone typically need to see results?
That's a great question, and it really varies.
Okay.
It depends on the individual, the condition they're being treated for,
Okay.
the severity of their symptoms.
Right.
So some people might only need a handful of sessions,
Okay.
while others might benefit from more.
Okay, so it's really personalized.
Exactly.
Okay. And we talked about safety a little bit earlier, but I think it's worth bringing up again.
Yeah.
Are there any risks or side effects that people should be aware of?
Yeah, for sure. It's important to remember that while dry needling is generally very safe,
Right.
especially when it's performed by a qualified professional, there are always potential risks with any medical procedure.
Okay.
So, as we mentioned, a little soreness afterward is normal.
Yeah.
But if you experience excessive pain,
Okay.
bleeding, that doesn't stop,
Right.
or any other unusual symptoms, it's important to contact your practitioner right away.
Right. Better safe than sorry.
Absolutely.
Okay. And are there certain people who should avoid dry needling altogether?
Yeah, there are definitely some contraindications.
Okay, like what?
So people with bleeding disorders,
Okay.
certain infections, or who are pregnant,
Right.
should generally avoid dry needling. And that's why it's so important to have that open communication with your healthcare provider.
Yeah.
They can help determine if dry needling is appropriate for you and ensure that it's done safely.
Got it. And I have to ask, have you ever encountered any skepticism about dry needling?
Oh, absolutely. Yeah, I mean, it's needles, right?
Yeah.
So it can sound a little bit out there to some people.
Yeah, like, do people ever think it's just a placebo effect?
Yeah, I get that question a lot.
Okay, so what do you say to those people?
Well, you know, while the mind-body connection is definitely powerful,
Right.
and there's certainly a psychological component to any treatment, the research on dry needling really goes beyond just placebo.
Okay.
We're talking about measurable physiological changes in the body,
Yeah.
improvements in range of motion,
Yeah.
strength, actual pain reduction.
Okay.
These are things that we can see and measure objectively.
So it's backed by science, not just wishful thinking.
Exactly.
Okay, that's good to hear.
Yeah, and the research is ongoing. We're constantly learning more about the benefits of dry needling.
Okay, that's exciting.
Yeah, but based on what we know now, it's definitely a legitimate therapy with the
Wow.
potential to really make a difference for people.
Awesome. Well, we've covered a ton of ground here.
Yeah, we have.
We've talked about the science behind dry needling, what to expect during a session,
Yeah.
what to expect afterward, and even address the whole placebo thing.
Yeah, and you know what? I think all this knowledge is really empowering.
I agree.
It helps people make informed decisions about their own health.
Absolutely.
So I'm glad we could have this conversation.
Yeah, me too. And I'm really excited for the final part of our deep dive where we're going to be exploring the future of dry needling.
Oh yeah, that's going to be interesting.
Yeah, like what's on the horizon for this therapy.
What kind of exciting advancements are we looking at?
Okay, so stay tuned. Okay, so we're back and ready to talk about the future of dry needling.
Yeah, I think it's a pretty exciting time for this therapy.
Yeah, I mean, the research is really starting to pile up,
It is.
showing how effective it can be.
Yeah, and that's leading to more acceptance in the healthcare world.
Yeah, which is great because it means more people can potentially benefit from it. I'm particularly interested in its potential for chronic pain.
Yeah.
So many people are struggling with chronic pain.
Absolutely.
And often, traditional treatments just aren't enough.
Right. They're not getting to the root of the problem.
Yeah, and it seems like dry needling could be a real game changer in that area.
Well, it offers a new way to target those deep trigger points
Yeah.
that are often driving those chronic pain cycles.
Yeah.
And as we talked about before,
Yeah.
combining it with education about pain
Right.
and targeted exercises can be even more effective
Okay.
at breaking those patterns.
So it's not just masking the pain, it's actually addressing the underlying cause.
Exactly. Yeah, it's about getting to the source of the problem.
Okay, and what about athletes?
Yeah, athletes.
You mentioned earlier that dry needling can be helpful for athletes.
Mhm.
What's the potential there in terms of performance enhancement and injury recovery?
Well, I think it's huge.
Okay.
Athletes are always looking for an edge, right?
Right.
Whether it's improving their performance,
Yeah.
recovering faster from injuries, or even preventing future problems.
Okay.
And dry needling can potentially help with all of that.
Okay, how so?
Well, we know it can improve range of motion,
Yeah.
reduce muscle soreness,
Yeah.
and even help muscles fire more efficiently.
Interesting.
So it's really about optimizing their physical function.
And because it's minimally invasive
Yeah,
and has relatively few side effects,
right.
it seems like a really appealing option for athletes.
It is. And as more athletes experience those benefits firsthand,
Yeah.
I think we're going to see its popularity continue to grow in the sports world.
Okay, so we've talked about how dry needling can help people with chronic pain, how it can be used to enhance athletic performance.
Yeah.
But who do you see as the main practitioners using this therapy in the future?
Well, I think practitioners with expertise in trigger point and myofascial pain treatment
Okay.
will definitely continue to be at the forefront.
Yeah, that makes sense.
But I also think we'll see dry needling become more mainstream
Interesting.
as the evidence base grows
Yeah.
and its applications expand.
Okay.
It's likely to become a valuable tool for a wider range of healthcare providers.
So we could see physical therapists using it more.
Absolutely.
Chiropractors.
Yeah.
Even some physicians.
Potentially, yeah.
Wow, that's pretty amazing.
It is.
It means more people could have access to this therapy.
Exactly. And it also encourages collaboration between different types of healthcare providers,
Yeah.
which ultimately leads to better patient care.
I love that. It's like a team approach.
It is. It is.
Okay, and what about research?
Oh, the research is booming. It's
Yeah.
really exciting to see.
What kind of things are they looking into?
Oh, they're investigating everything from headaches and migraines
What do you got?
to fibromyalgia,
Wow,
pelvic floor dysfunction.
that's amazing.
Yeah, the possibilities are really endless.
It seems like we're just scratching the surface of what dry needling can do.
I think so, yeah.
Well, this has been a fascinating deep dive.
It has.
We've learned so much about the science, the applications,
Yeah,
the potential benefits,
absolutely.
and even what the future might hold for dry needling.
It's been a pleasure sharing my insights with you.
The pleasure was all mine. Thank you so much for joining us today.
You're welcome.
And thank you all for listening.
Yeah, thanks everyone.
We hope you found this deep dive informative and engaging.
We encourage you to keep learning
Yeah, keep exploring.
and stay curious about your health.
Absolutely. Until next time.
See ya.